have a rich program ahead. We want to make sure that it's worth your while. I know that it looks like it's packed, but we're going to try to make it very succinct and straight to the point. So please, to formally start off our show of events, join me in welcoming Dr. Christabel Gerer from the Population Council. Welcome.
So just to expound further on CETA, it's a framework that we hope to, adopt and to help us in, addressing issues around adolescent girls' use of digital spaces.
These AI implementations are really an exemplification of that. It's really helping NGOs and organizations to do more with less, which unfortunately is the reality on the ground today. And so Eminata is a great example of that. I'm going to show you in a moment where we're using AI to do extension outreach to the youth, in particular in this case with sexual and reproductive health and adolescent care, in a private, confidential, and knowledgeable way.
In Kenya, we reach over 60% of 15 to 24-year-old, and we do this using media that's trusted by our audience, and it's barrier breaking, and we're really excited to be in this room today, mostly because we have we like to call them our fans in here so that they really can speak for themselves.
So for me, I use AI as an emotional support on a daily basis. When you talk to these people, young people out here, a 14-year-old tells you something and it breaks your heart, and you really don't know where to take your feelings. So, and I also can't equally tell it to someone else because you're also supposed to be confidential about such information. So I find it easier to just go to AI, pour my heart out there, and it will definitely make me feel better at the end of the day.
At eHealth Africa, we're very intentional around our partnerships and programs. We are big on ensuring that we have human-centered design in terms of the programs that we develop, design, and implement across not only Nigeria, but across the continent. Over the years, for over 15 years, we've been able to develop a strong track record in implementing some of the most life-changing and life-saving programs around public health emergency management, disease prevention and monitoring, laboratory systems and diagnostics, and climate adaptation in health, food security, and nutrition.
The reason we did this is because we believe the youth in Africa is the next powerhouse of the workforce. And the reason we say so, as we know, Africa has one of the youngest, as actually the youngest in average age compared to other continents.
So for me, I think what is really important is we were able to have youth today to talk about what responsible AI and digital tool means for them, and how we as developers, builders of these solutions can actually take that into account for these type of solutions.
Today we've been at the Global Digital Health Forum side event, where we've curated the session alongside our partners eHealth, Rich Digital, and really the session was to discuss how digital interfaces are spurring behavior change in adolescents in Africa specifically. So Shujaz, we've curated and we've ran a panel with young people in our network.
We believe that AI has a huge potential, but we also believe that it's important to look at the foundational pieces that healthcare still requires in sub-Saharan Africa and in Africa in general. And so for AI to really be a reality, we need to ensure that it's built on sustainable systems that are well connected, systems that have the specific requirements that are needed to ensure that really it moves from like a potential to an actual reality, and also to really ensure that we are putting AI in the real use cases that youth needs, not just using AI for the sake of using AI, but really understanding that what pieces of AI will leverage and enhance the capabilities and the engagement that we have with users. So that would be my input.